Good evening, everybody. All of us who have joined us and who probably will look at this video or this recording a little later. Welcome to our FB Live show. I am Dr. Mamta Dighe. I am the director of Zenith Advanced Fertility Center. We are an advanced IVF center located in Wakad as well as Goregaon Park in Pune. I have been doing IVF for the past more than 20 years now, and it's been a wonderful journey for me. You know, it's like coming a whole circle, starting where people hardly knew about IVF to the way IVF has grown and the number of people who are using this technology now. So it kind of gives me a complete perspective into, how things have changed, how things have moved. We have the World IVF Day coming up. And today, when we thought about becoming parents or embracing parenthood through IVF, initially I thought that what can I talk about really? I mean, parenthood, the desire for parenthood, the feeling of wanting to be a parent is such an innate feeling. It's such an intrinsic feeling. And what does one really talk about? Love, joy, parenthood, motherhood, fatherhood. I mean, what do you really talk about it? What happened is that one of my patients happened to come. She had seen me some time back and she came for some other reason, with somebody else, and we got talking. And she'd been married now for the last 8 years. She's 37. And I asked her, I said, what about, because she had seen us for the question of conception. And then she talked to me and said that my husband feels we're not financially ready and maybe, we still need to take more time. That is when it struck me that maybe, the whole process of parenthood and wanting to becoming parents and the thoughts around it are changing. Of course, things are changing. Of course, lives are changing. Of course, environmental and lifestyles are changing. Unfortunately, what is not changing is the biological clock of women. And even though couples may have the desire of wanting to provide everything perfectly for their children, if we wait out too long, then it might cost the couple the ability or the possibility of having their own biological child if they do not understand that there are constraints of time where women are concerned. In fact, Indian women have been seen to have a reduced reproductive capability in terms of their ovarian reserve. They have a lower ovarian reserve. It might not be right to say reduced reproductive capability, but they have a lower ovarian reserve. They have less number of eggs in their ovaries. So it is very important for our women, our couples to understand that this journey and the joy that parenthood can offer needs to be considered at the right time. And parenthood, is always going to be a trial of fire. I mean, even after you have children, it is going to be a trial by fire sometimes. I remember somebody telling me, smaller the children, smaller the problems, bigger the children, you may have bigger problems. So once a parent, always a parent. Once a mother, always a mother. Things are always going to keep coming up. Concerns are always going to keep coming up. Things are always going to change. Trying to do everything perfectly so that we are able to provide with every need, which need not be a basic need, but needs that we perceive, needs that we want to fulfill for our children. And very, very good if we want to do that. But we must understand that time really does not wait for anybody. And for women, it is important to understand that there is a good time when your body is prepared for reproduction. And if you conceive around that time, that is the best thing for any woman to do. Of course, nature taking its course and conceiving naturally is the best thing to happen. We've always called ourselves an advanced fertility center and not an infertility center, because after practicing infertility and IVF for so many years, I do believe, and everybody should know, that the best way to conceive is to conceive naturally. There are no two things about it. But if one is finding difficulty in conception, it definitely does not mean in today's day and age that they cannot use the technology available as of today. Ultimately, if we want to fulfill our desire of parenthood, if we want to embrace the joy that parenthood has to offer, we must try our best to first understand how can you best conceive naturally. And to understand that, you need to understand the effect of issues as they age on their semen sample and their sperm quality. But that happens much later in life for men compared to women. And hence, I keep talking about women and women and women aging, and please pay attention and all these things, because I really feel that awareness is key. If we do not know what we are dealing with, it will not even strike us that this problem could affect one of us. And that is the reason why one needs to understand. So this joy of parenthood is something that couples should start considering quite early on. Even when one wants to take some time to get into this, it is always good to understand whether you have that time. Because suppose if a woman has a low ovarian reserve and she's not aware about it, because a woman will continue to have regular menstrual cycles, she will continue to ovulate, and she will not even know that there is a low ovarian reserve. So if you do not know that there is a low ovarian reserve, and let's say you delay pregnancy for 3 years or 4 years, the ovarian reserve is going to keep falling in that time. And by the time you plan pregnancy, maybe the number of eggs in the ovary have reduced to such an extent that natural conception may become difficult. And hence, it is important to get a general assessment of where you stand before you decide to delay pregnancy for a very long time. That is something very, very important in terms of parenthood that I would like to get across for everybody. What about embracing parenthood through IVF? Now, like I said, it is important and it is the best thing if one conceives naturally, and that is what everybody must look at always. And hence, it is important to make sure that your general health, your physical health, your emotional health, your mental health, everything is conducive. Your environmental health, even your environment at home, is conducive to, helping fertility grow in the woman and in the family. That is a very important aspect. But if things are not happening, then what is, can one really embrace IVF as a process to embrace the joy of parenthood or go through this journey? Now, many times I have seen that there is a lot of concern around choosing IVF. Maybe rightly so, and also because since a very long time, being childless has been made out to be a problem, which is not really a medical problem, but as if the couple are to blame for it, for whatever reasons. Though things have changed drastically over the years, this is what was the societal norm years back. And maybe some of it has continued. So people do not understand that there are medical reasons why a couple may not be able to conceive. And these medical reasons at times can be only tackled by the use of IVF. And hence, if required, IVF is a wonderful method and technology to embrace or to adopt in order to go through and achieve parenthood. Now, who should go in for IVF and when should one consider the option of IVF? It is usually felt again by couples that IVF is the last resort that one can take. And I would tend to put it differently. IVF is not always the last resort, maybe the first resort for certain couples who would be unable to conceive unless an IVF is, chosen by them. Such couples are ones in whom the women's tubes, both the fallopian tubes, there are two tubes by the side of the uterus. So if both the fallopian tubes are blocked, there is no way for the oocyte and the sperm to come together to form an embryo, and hence such couples or such women will always need IVF for conception. Second is men who do not have sperms in their semen. Such men, many of such men do produce sperms in their testes. But due to a blockage in the ducts which carry these sperms out into the semen, these sperms are unable to be present, always need IVF and ICSI for achieving parenthood. Now, if such couples think that IVF is the last resort, it is not really correct, because in such couples, without using IVF, pregnancy is not going to happen. And hence, it is important to first understand your own fertility potential, where you stand vis-a-vis fertility. We cannot expect that just because a couple gets married, that presuming that everything is correct. There are so many of us, especially nowadays, we tell and advise people that do your routine checkups. Please understand whether your health is good. We take care of our nutrition. We take care of our exercise. There are so many, centers which are catering to gyms and exercise and so many other things, running, and fantastic. I think one really needs to take care of, your own physical health. But what about your reproductive health? Because each is a part of your life. At some point or the other, having the desire of parenthood is going to come. So why not prophylactically understand where you stand vis-a-vis your own fertility and then take a call? So in such patients, IVF is the first resort, not the last resort. In fact, it is the only resort that one will have to adopt. Again, in women who are older, especially we see nowadays that women are getting married later. There are so many women pursuing fantastic education, fantastic careers. Unfortunately, while this time is being spent over here, the ovarian aging tends to happen. And with the delayed age of marriage and then delayed conception, it can become difficult to conceive naturally. Again, in older women or in women whose ovarian reserve is low, women who have less number of eggs in their ovary, again, IVF can be considered as the first option. I'm not saying that, natural conception is not possible in such cases, but IVF can be considered as the first option. So there are many indications where IVF is in fact the first option. Especially in young women who, let's say, are married at the age of 23 and they've been trying for 6 years, and now let's say they are about 4-5 years and they are about 27, and they always say that we were just told that you're still young, there's no need to worry, so even if 4-5 years have gone by, one need not worry. In fact, it's just the opposite. The younger a woman, the higher her chances of pregnancy. So especially if a young woman is taking 3 years, 4 years, 5 years to conceive, and even though all the reports may be normal, there is a problem that one must consider. Everything may not always show up on your reports. We need to understand that pregnancy, it's only, and I'm sure people who have gone through IVF would have experienced what a miracle conception is. Because even after doing everything in IVF, sometimes pregnancy and conception does not happen 100% of the times. So that is why everything will not meet the eye. Everything will not always be seen on your investigations. And therefore, a clinical judgment is also important. So if you have a couple, a young couple in fact, and they have not been able to conceive for the last 4 or 5 years, one must try and understand that again, here is a couple where IVF may be indicated, or at least some form of treatment may be indicated. What I want to get across is, first, parenthood is going to come up. This desire is going to come up for most of the couples. And if it does not come up, absolutely fine. Each one has their own journey to take, has their own path to walk. But most of the times we have seen that, couples will feel the desire of parenthood at some time in their life. The early we understand that the road to parenthood might take some time, that it's not a quick fix, that the moment you decide that you want to become parents, you will always become parents, and some time may be required. Hence, earlier you start planning, the better it is. That's the second point. The third point is that for whatever reasons, we understand that they need to know that their biological clock is ticking, and just keep a watch so that they should be able to try and conceive naturally as much as possible. The fourth point is that in case natural pregnancy is becoming difficult, you must see a reproductive medicine or a fertility specialist so you understand where you stand. And the fifth point is, what if you have come to the point of considering IVF? I'm sure there is so much available on the internet now that, one need not kind of go into every basic step of IVF, but still there are so many myths. Couple walks in, they keep saying that we've heard that it is extremely painful. There are, like life changes completely. There are a lot of side effects. There are a lot of complications. You have to completely have bed rest for 9 months of your pregnancy. So one needs to understand that IVF is not as difficult as it is made out to be. It is more difficult because one sometimes cannot understand, or one sometimes feels that they are having to do IVF when these things should have come naturally to them, and therefore this process sometimes becomes a little emotionally charged. But hence, educating yourself about the IVF process, how it is done, what are the best methods, what are the newer advances, what are the things that one must pay attention to, that definitely will help. So let us understand how one can prepare for their IVF process. I think preparing for IVF has three factors to it. One is your physical preparation, second is your mental and emotional preparation, and third is your financial preparation. I would say there is one more step to preparation, and that is understanding which is the place that you would like to do your IVF cycle. So let us look into all these three, or let us say 4 factors. So first is the physical preparation for IVF. Now, one thing we all understand is that everything is going to need a healthy body. There is an effect of your health, of your general health, on the effect of the quality and the number of your oocytes. So hence, maintaining good physical health, having good diet, good nutrition, having some form of exercise, making sure that the body weight is normal, the BMI as we call it, the body mass index, is within the normal limits, is a very important physical consideration, and one needs to physically prepare their body. Making sure that you take the right supplements, making sure that the levels of vitamin D and the levels of vitamin B12 and other vitamins in your body are adequate is another important factor. So hence, looking into your nutrition, your diet, your exercise, some kind of mindfulness, is a very important factor of maintaining your health. We also tend, and we also usually make sure that the prenatal vitamins are being taken, and if there is a deficiency of any essential nutrients in the body, then those need to be substituted. Are your thyroid levels normal? Are your other hormones normal? Are your sugars normal? A very, very important factor, especially in the Indian diaspora, because we have seen that the Southeast Asian population and Indian people have a very high incidence of diabetes, and even young people have a high incidence of diabetes. So do not miss out on checking these problems as far as the physical health is concerned. At Zenith, we have a nutritionist on board who If we think that, there are certain deficiencies, there is obesity, maybe a detox is required, then the couple is definitely can consult our nutritionist, and then they can embark onto, the IVF cycle after they feel physically fit. Or if weight reduction is required, then the requisite amount of weight reduction is done, and then the IVF is started. Now, why is weight such an important factor? We have seen that obesity has an impact on fertility, it has an impact on the egg quality, and it has an impact on the success rates. And hence, if there is obesity, one must definitely consider reducing weight before embarking on to IVF. The next is your emotional or mental preparation for IVF. Now, how do you go about doing this? I think first and foremost, we have to address our, you have to look at your own self. Are there feelings of fear about the process? Are there feelings of guilt? Are there feelings of shame? Is there a feeling of victimhood? Are you not taking care of your emotional needs well, within yourself or along with your spouse? Therefore, addressing these needs are very, very important. Make sure you talk to your spouse. Make sure you're both going through this journey together. And like I always advise, inculcate some form of mindfulness, breathing techniques, yoga, or meditation into your day-to-day rhythm, so that, you're just better able to cope with the emotional highs and lows that come along with the IVF cycle. The third is the financial preparation. Now, why financial preparation? We know that IVF is not a very cheap process. I won't say that it is an expensive process in terms, because I think that for the kind of the technique and the technology that has to be used, and for the lifetime of happiness that the IVF process can give a couple, it is always the question of cost versus value. Value is a very different thing. Value is what adds to your life. So one must also consider the value that is being added to life. I know there are some people or some couples who come to me and say that, can we try an IUI because we cannot afford an IVF? And of course, there will be certain couples for whom IVF is going to be difficult and financially difficult, and definitely one must make, not only the couples, the centers also should try and see how that couple would be able to go through the IVF cycle. But remember that it is always the question of the correct treatment. So doing a treatment just because it is less expensive is not always going to be the right thing for the couple. But hence, it is important to become financially prepared. Knowing that IVF may not always give you the success rate just through one single cycle, it is important to consider your finances, understand what IVF entails, what may be required, maybe one single attempt, maybe two attempts, maybe a frozen embryo transfer. So one must get ready for all this and then embark on to an IVF cycle. And the last is about choosing the center. The physical, mental preparation, putting you on supplements, making sure that we are creating the right base and doing the right stuff before we start the IVF cycle. But there is another aspect to it, and that is the aspect where the clinic comes into consideration. So choose your clinic well, understand your doctors. Once you meet them, feel whether, they are the right fit for you. Everybody is not for everybody, isn't it? It is that some people definitely will feel more comfortable with certain people, and understand, who are the people. I always feel that it is important to understand the people behind the technology. It is not the technology that is just being driven. It is the people behind the technology who are using it wisely and appropriately in order to give successful pregnancies in IVF. And hence, knowing the people behind the technology, is the lab equipped? Who is the doctor? Who are the embryologists? What is the experience? Are there full-time embryologists? All these things become very, very important whenever you decide to go ahead with a certain clinic and you are planning to do an IVF. how the labs are these modular labs, is batch IVF being done, or are continuous IVF cycles being done? Is the quality management and quality care really being taken care of? All these factors are again going to contribute to the success of IVF. So this is how preparation for IVF needs to be done and needs to be taken care of. There are many times when people come and directly talk about the most advanced technology that is available in IVF today, and like performing a genetic screening for every embryo, for doing a laser assisted hatching for every embryo. And I think there is one point that I want to make across to everybody, is that the right technology has to be used at the right point and the right indication. Just because the technology is available does not mean that it is required, neither does it mean that it is the right thing to do for every patient. And therefore, talk to your doctors, understand what is there, what can be done, what should be done, what should not be done. So it is very important to educate yourself to a certain extent. Try and see whether you can talk to your friends or other people or other couples who've been through the process. Basically, in IVF, the whole process of pregnancy that is happening inside the body of the woman, that is taken care of in the laboratory. So the oocytes, or the eggs which ovulate from the ovary into the peritoneum and which are picked up by the tubes inside the inside the body of the woman, here in IVF, we are actually taking these oocytes out of the body. But in a natural cycle, a single oocyte or a single egg is formed for the woman. We cannot work with a single egg, because every egg that a woman makes is not always does not always have the potential to give a pregnancy. And hence, we need more than one egg in order to form multiple embryos. The woman starts taking these injections from the second day of her menstrual cycle, and usually for about 9 to 12 days, injections are needed. During the course of these days, the follicles develop and then they reach a stage of maturity. And the oocytes which are present inside the follicles are retrieved outside the body of the woman. This is done with a small procedure. This procedure is done under general anesthesia, so there is no pain involved. There is no, no dissection involved, no cut involved on the body. As soon as these oocytes are obtained, they are sent into the laboratory, and the embryologist scans and looks for these oocytes, because oocytes are never visible to the naked eye. They are microscopic. So only once you put the fluid under the microscope, you will be able to pick up these oocytes. These oocytes are then fertilized with the sperms of the husband on the same day that the oocyte retrieval is done, unless a woman has decided to freeze her oocytes. Now, freezing oocytes is a separate thing altogether. I'm not going into that, but most of the times when a couple is going through an IVF procedure, the oocytes are fertilized with the sperms on the same day that the oocytes are retrieved out of the body. The fertilization check is done after about 22 to 24 hours. And then these fertilized oocytes, which we then call embryos, grow in the laboratory. Now, in the laboratory, you have to create an environment which is very, very similar to the environment present in the body of the woman. These eggs or embryos are never exposed to differences in temperature. They are never exposed to dust particles. They are not exposed to volatile chemical substances, like paint and other volatile substances, and which all of these can cause and affect and decrease the quality of the oocyte or of the embryo. And because of this, the IVF lab has to be strictly maintained. to make sure that the temperature within the lab and within the instruments that are used, the incubators, the laminar flows, etc., is very strictly maintained. The IVF labs are provided with air handling units where no dust particles are allowed to enter, into the air that is flowing inside the IVF lab. The walls of the IVF lab are made of a material where dust and other maybe particles, bacteria, viruses will not, really be able to stick. So you cannot have general walls in an IVF lab. So you have to create an environment in the lab and in the incubators, which is very similar, especially in the incubators, to that which is present inside the body of the woman. So these embryos are then cultured inside incubators, inside, culture media, because you need certain substances, growth factors, etc., which the embryos are going to need for their growth. These embryos are then cultured in the laboratory and in the incubators for anywhere between 3 to 5 days. After which, these embryos can be put back into the womb or the uterus of the woman. Now, when you create embryos and then put back these embryos in the womb or the uterus, immediately in the same menstrual cycle or in the same cycle of the IVF stimulation, this is called a fresh embryo transfer. When these embryos are frozen and then the embryos are transferred back inside the uterus during another menstrual cycle, that is called a frozen embryo transfer cycle. Now, there are differences in success rates between a fresh embryo transfer and a frozen embryo transfer. But again, it is important to understand that one needs to individualize. It is not that every patient or every couple will have a less chance with a fresh and every couple will have a better chance with a frozen. So depending on the indications, the circumstances, one can decide whether a fresh embryo transfer should take place or a frozen embryo transfer should take place. So once the embryos are transferred back into the uterus, then some medicines are given in order to provide hormonal support to the developing embryo inside the uterus. After about 14 days of putting these embryos back, one can do a pregnancy test and find out whether the implantation has happened or not happened. And if the implantation has happened, then the medications need to be continued for some more months till the proper establishment of the fetal heart rate or the clinical pregnancy for the patient. Now, this is, in a nutshell, how the process of IVF takes place. Today, with the advanced technology, with, so many advances with blastocyst transfer, with the newer drugs that are available, the labs that we have, instruments that we have, the success rate of IVF has really, really increased. And at least about 7 to 8 out of 10 couples will achieve their dream or their success with IVF. Now, you need to understand that to do 2 or 3 embryo transfers, one has to do a good ovarian stimulation so that you can make the maximum number of oocytes and embryos at a given point in time, and then achieve a good cumulative pregnancy rate for a couple, which makes it much easier for the couple to go through the pregnancy and to go through IVF. Now, after the IVF, what are the do's and don'ts? A lot of people still believe that post-IVF, one needs to take complete bed rest, and that is not correct at all. We do not advise any of our patients that you have to go through complete bed rest after an embryo transfer. In fact, quite the contrary. Doing or taking complete bed rest actually may not be a very good idea. When you're moving about, your whole circulation is going on quite well. The uterus is in its proper position. You are, because you're taking medications, there is sometimes a lot of constipation and other issues that come up. So especially when you're moving about, you're taking care of your diet, you're walking, it makes it much better for the whole digestion also to take place. It is not at all that these embryos are going to fall out if you stand or you move about. Once the embryos go in, the embryos will be there. They are not going to go anywhere. It's just the question of the dialogue between the embryo and the uterus, and how this embryo is going to implant into the uterus. What is important is to understand that in the next 14 days or 15 days, the 2 weeks, which are going to become difficult for you because of the anticipation of the result, the uncertainty is becomes very, very difficult. And I know that for some couples, it is the 2 week period that is more difficult than going through the whole IVF process. So during these 2 weeks, the advice is that, concentrate on your nutrition, take your mind away from the constant thought of whether pregnancy is going to happen or no. Go out for a good walk, watch a good movie, make sure that you take your medications in time. That is extremely important. Do some mindfulness, meditation, breathing techniques, talk to your spouse, continue with your work that you are doing. There is absolutely no need to completely take off from work unless it is becoming very stressful for you. So, keep up the positivity in you, and do not stress over, and do not kind of continuously think about what is going to be the outcome. So managing the 15 days of wait after your IVF is a very important process too. And also a very important time to concentrate on your diet and nutrition. Don't eat too much of spicy and fried food. Make sure that your bowels are working well, because the medications may give rise to constipation sometimes. So all these things are going to help you, go through the IVF process in a much, much better manner. So what I want to do today is to try and say that, IVF is a technique which has truly shown that it works wonders. There are millions of children today in the world who are IVF babies, and we know that the first IVF baby has her own children conceived naturally. So, IVF children are similar to natural conceptions. Yes, there is truth in the fact that the process of IVF, and especially ICSI, can sometimes increase the risk of certain malformations, but the risk is only marginally high compared to that in natural conceptions. And most of the children who are conceived and born through IVF are similar to those conceived naturally. With the advances, one can even check, whether this embryo is normal before doing an embryo transfer. It is also a great method for families and couples who have a history of genetic abnormalities in the family. Because when you create embryos through IVF, you can actually test this embryo and understand whether this embryo is carrying the particularly genetic problem that is present in the family, and you can choose the embryo which is not carrying this chromosomal or genetic trait, and then use this embryo for the embryo transfer. So IVF again is a great method which can be used by couples where there is a history of genetics, abnormal chromosomes and genetics in the family. So, all in all, IVF is a wonderful method. Yes, it needs to be chosen for the right indications and at the right time. Doing IVF either very early, just too early, rushing into IVF when there is really no need for it, is also not the right thing. But at the same time, delaying IVF when one really needs IVF is also not right. Because the earlier, if IVF is required truly, if there is an indication for IVF, then the earlier you embark onto the process of IVF, the better the success rates are going to be, because the younger the woman, the more number of oocytes and the lesser the duration of infertility, the higher are going to be the success rates with IVF. So IVF, all in all, is really a wonderful method for couples to consider. One must, educate themselves well, to first understand what IVF. Mental preparation is very important. At the same time, it is important not to go into, what the naysayers are, or somebody who is constantly saying that IVF is not good, IVF is bad, because it's a decision each couple needs to take, and without really understanding what it entails, giving up on a method which can help you achieve pregnancy and parenthood would definitely not be the right thing. So think about it, understand where you stand, understand your reproductive potential, understand whether IVF is really needed, understand whether, this is the right time for you to consider using IVF as a process for achieving parenthood. And if it is needed, like I said, there is a preparation phase for IVF, whether be it physical, be it mental, emotional, be it financial, be it understanding and educating yourself and understanding which fertility center feels like the best fit for you, and which seems like a center which would be able to help you towards your journey of parenthood. Again, going through the process of IVF is something that I have explained, as I have talked about the process after the embryo transfer. Once the pregnancy is achieved, the medications will need to be taken for the first few months, and after that, the process is as one would go in a natural pregnancy. We have had many, many, many women who have delivered vaginally, normally, with IVF conception. So again, it is a myth that only a cesarean section is required if one has conceived through IVF. Yes, our threshold is low. Yes, at an indication where we feel that it is safer to go with a cesarean, being an IVF conception, the threshold for taking the decision for a cesarean section may be low, but it does not mean that every woman who has had an IVF conception needs to go through a cesarean section. So all in all, this is about, the IVF process and achieving your dream of parenthood through IVF. So the message is that do consider what parenthood means for you. When is the right time for you to embrace this journey and this process and this joy? But also, please understand your own individual reproductive potential. Do not take decisions to delay pregnancy, even natural pregnancies, just based on your your environmental conditions. Take these decisions also based on your own biological conditions. So then that makes it a more holistic decision. And once you really understand that there may be a need for you to use IVF in order to achieve pregnancy, one must definitely keep an open mind, consider the pros and cons, understand where IVF stands today, understand what it entails, and then take a decision of whether, and when you would like to start the process of IVF. Now, thank you so much for joining us. I hope that I've been able to shed some light onto what IVF is all about, what it means. And if you look at so many people and so many couples who have conceived through IVF, I'm sure they are feeling very happy that they chose this option, because like they say, sometimes the joy of parenthood is incomparable to many other joys that one may experience. So, talk to successful couples who have been through IVF. They would be able to talk about their own issues, their own fears, their own journey, but also be able to tell you how it really helped them to, achieve this joy in their life. So thank you so much for joining us, and wish everybody a happy World IVF Day. And that is all from us for this weekend. We hope you have a lovely weekend, and we will come up with more and more topics, and more and more FB lives, so that we can have an interaction with all of you. So thank you, and signing off for today.